I would describe midwifery as a very ancient tradition, one of the oldest professions in history. Midwifery has come a long way over the centuries, where friends or family or trusted community members would come and act in that role. It's become a really nicely integrated profession into the healthcare system, where midwives, doctors, pediatricians, nurses, we all work together to collaborate and provide the best possible healthcare for our communities. My name is Kate Bondi, and I'm a registered midwife in Ontario. I chose midwifery probably well over a decade ago, before I even really considered a full career in it. A friend of mine at the time was a registered nurse and brought me in for a shift on labor and delivery, and I absolutely fell in love watching her give that kind of care to her patients. The one-on-one that you get, like the relationships you build, the fact that you can help to guide somebody through such intimate and special moments, I feel like was very profound, and watching her work really drew me towards the profession. In Ontario, you can choose between one of 3 different types of healthcare providers for your pregnancy and postpartum care. So you can choose either between an obstetrician, a family doctor, or a midwife. Why a person might need an obstetrician over a midwife or a family doctor would be if they have a more complex medical history. So midwives are specialists in low-risk pregnancy care. We have 3 main pillars to midwifery care, which are continuity of care, which means that you meet your midwives and then you get to know them, and then one of those midwives is at your birth and does your postpartum care, right? So you really build a relationship with the person who's providing care in these very important moments in your life. And then after that, of course, we have informed choice discussions. So our prenatal appointments are half an hour in length, and that's because we like to sit down with folks, really go over all of their options throughout their prenatal care, putting them at the forefront of choice when it comes to what tests they want to do, ultrasounds, how they want to make decisions about their own care. So this is my assessment bag. So this is the bag that I would bring with me for all of my home visits and also for labor assessment and using it throughout labor as well. Most specifically for labor, a Doppler. So this is a Doppler and some gel. And this is what we use to auscultate the fetal heart rate. This is a pulse oximeter. This is something that, for a home birth, is more important for managing an emergency if the baby needed resuscitation. This is how we check to see how well oxygenated the baby is. This guy's pretty old school. Little brass scale out here. I do a lot of country home visits, and a lot of my clients will tell me that they use this to weigh the farm animals. We will lay the babies out in this little hammock here, and then attach this to here and get a weight check by just lifting them up. And that's how we weigh babies at home. It doesn't matter where we're having a baby, whether it's at home or in the hospital, but initial steps would be to offer that person a full physical assessment. So when we meet up with them, we are doing a blood pressure, checking their temperature, their heart rate, their breathing, listening to the baby, and then sort of having a feel to see what position the baby's in, and offering a cervical exam to check how dilated that person might be. For people planning a home birth, sometimes they choose to plan a home water birth. These tubs can be really nice for pain relief, and getting into the tub in active labor can really help to kind of reduce that strong intensity of contractions, maybe make it a little bit easier to breathe through them. A lot of people find a lot of relief in using a birth tub. So when a midwife comes to your home for a home birth, we bring with us all of the equipment that we would need to respond to any type of emergencies at your home. So essentially what we do is we set up a little station for the baby here. So this would include a heating pad, a stethoscope to listen to the baby, a couple of devices here for suction. So this would be a little bulb syringe to help remove secretions from the airways, and then this one here is for deeper suction with a little bit more power behind it. We also bring a bag and mask and oxygen, so this would be the device that we're using if the baby needs some help breathing. So these are sort of like the basic tools, but then we also have things that we might use if a baby needs intubation or like a more prolonged resuscitation. We carry all of that equipment with us as well. Midwives go back and do a training program for neonatal resuscitation that we take every year without fail, and that's to A, keep up with our credentials, but B, this is just such important life-saving information, so it's important for us to stay up to date on this every year. We come loaded with a little bit of everything, most of which we will put out and then hopefully not have to use. Over the past 35 years, midwifery has been constantly changing in and of itself. I think it's a profession that encompasses a lot of advocacy, and because of that, we see changes in access to care. So a lot of midwives are offering easier access for reproductive health, for example, where we're now offering contraception, IUD placements. Some midwives have become specialists in lactation, so they sort of like take on specialties of their own. And I find that midwifery as a whole has probably just made different parts of reproductive care more accessible to the general population.